volunteers. It comes from somewhere, and these supplies came from South Bronx. So that's an important point. Again, family-oriented, making a difference in our community, and volunteering and offering supplies. With that, I'd like to go over a couple of ideas that I have, and we have a couple of events coming up that I'd like you to be a part of in the future. But I would also like to recognize South Bronx with something I'm going to offer, and this is a certificate, and that's making a difference in our community. And this is something I'd like you to, in recognition, and this is from the Skate Key Roller Rink Church of Life Community Church and the Ask Dr. Tommy O show. And this is what we had, a food drive. It was called Food Drive 2005 in health screening. And I would like to thank you for your devoted and caring services, and I'm presenting it to South Bronx Pharmacy.
Okay.
Thank you.
Thanks
Welcome.
a lot, Doc.
Again, making
All
a difference.
we do is, do what we have to do for the community that we're in.
All right. Okay, now I'm going to present what we call a case presentation. Let's say a patient of mine comes to me for the first time, and I write prescriptions, and then these prescriptions must be filled. The patient comes to you for the first time. How do you go about, for the first time, seeing this person when they enter your pharmacy? What are the appropriate steps?
Well, first we got to give them HIPAA, which is, privacy. We have to make sure that privacy is guarded. And we discuss the medicine, if they are aware what the medicines are for. Try to find out if they know. If they don't know, then we counsel them on the medicine and explain the effects, the pros and the cons of it.
Right.
And we try to find out what kind of problem the person has on a personal level, to really kind of associate ourselves with that person. And then we proceed with receiving the prescriptions and passing it along.
Right. Now, do you have any fail safeties that are set up in your, your daily progress? A person comes in, again, what's your fail safe? Say, are you giving them the appropriate medications? What happens? You want to make sure you don't give them the inappropriate medication, mislabeled. How do you go about that?
Well, when we get a prescription, we take it in, we give it to the girl types it up, and then it goes to the pharmacist. The pharmacist review it, then it gets counted. It gets counted twice. We have machines which you can tell on the machines that we have.
Because the machines actually show you the pictures of the medications. We'll show you the pictures of the capsules. So it's another check. It's another check. Besides the human checks that we do, we have the mechanical checks we do, and they're very, very helpful. They're very and it keeps us from making errors. We have very, very
we cover.
Covered.
Then after that, then it comes to the front, and before it gets to the customer, it gets rechecked.
Right. You read.
Visually, we read and we check the bottles, and then we give it to our customer.
Okay. So we're talking at least, from what we understand, at least 3 fail safeties.
Actually 4.
Even 4. That's even better. 4.
Yes, we make sure. We take our time. Sometimes some of our customers get upset, but we take our time and we try to do it fast. It's kind of a mix.
Mix there. Well, that's important because safety comes first. We want to turn out a good quality product with safety, because medicine is about being safe, continuity of care, quality of care, and providing health, and that's what medicine's all about. Now we're talking about the machines. I know years ago it was just by manual. Now we have a nice fancy exotic machines that do the counting. These are important. Do every pharmacy have these machines, or just
very, very few. Very few.
Okay, again, so
maybe 1% of the pharmacies out have this type of machine.
So that's important. Again, another fact that you need to know that the South Bronx Pharmacy has is extra safety measures that are set in motion to help prevent miscommunication, the giving of inappropriate medications. Very important. You're just not a number here. Again, they cater to your needs. Also, let's go over that educational component. A lot of times, myself or other physicians, because of the way what managed care is, we're running through the patients, because now it's not really about care anymore. It's about and no one wants to admit this, but everyone knows because no one's willing to go on TV to say it. But the fact of the matter is, managed care has forced us to do high volume. Whenever there's volume, you have increased risk for error and then decreased amount of time spent on education. Now, for me, I make sure I place a heavy emphasis on education because I was an educational instructor. I was a high school teacher before I became a physician. So no matter what, I place a heavy emphasis on education. Now, again, a patient comes in, even if they're here for a follow-up, you said you place an emphasis on education. You educate them both in English and Spanish. Can you go a little bit more?
Yes, we also have a computer on the front that will tell them anything about any medicine at all. And we guide them to it, and we just help them out with that. They walk out of here knowing about the medicine they're taking.
And
they're not blind.
also that computer, besides the medication, it also covers the diseases that the patient will have, so that the physician who doesn't have the time today in managed care to stay with the patient and educate them, these patients now can use this machine and really get a fine education. It's simple and it's bilingual. It can be in Spanish and English, and it's very, very helpful.
Yeah, that's important. I noticed that when the patients come in back, they have the bag from the pharmacy and they have a print off with it and it has the medications on it. Is that part of the fail safety?
Yes.
Okay. Where does that come from? Where do you have a computer system? How does that come about? Because it's not handwritten. It's all typed.
This is part of the computer system that we have, the program.
Okay.
To educate. That's all we
Part
do.
of the education is the safe, what we call the fail safe or safety net. Okay.
Right, and in today's market, your patient should be looking for that, because the amount of mistakes that are made in pharmacies are tremendous, very, very high now, because of the change and high volume that the pharmacist doesn't have time to really look at the medications and the prescriptions. And we're looking at it 4 times, and in the chain, maybe they can look at it once if they have the time.
Right, exactly. Well, again, another fail safety is the fact that you make that phone call to me, or actually you walk over to the office and then you'll pull me aside and say, is this what you really wanted? Or the patient's telling me this, but you wrote something different. And that's, again, that community, that continuity of care with the communication. It's very important. A lot of times I have a fail safety built into my prescriptions where I have certain codes on my prescriptions, and that protects me as well as the patients. And if there's any changes to the prescriptions, you'll know it right away. And I'll receive that phone call and say, well, you wrote for 10, but it looks like someone put an extra 0 in there for